Now let's talk about some of the things that you deal with.
Sure.
Specifically. Some are related to age, like people my age. Others, even children, are involved in physical therapy.
Correct.
And then you have this middle range of people. What is some of the people that you take? What are the categories of people that you take care of?
Well, like you said, Russ, we have patients from as young as 4 to 5 years old and to up as old as 95 years old,
Yeah.
which is fantastic. We have a really good supporting group of physicians that refer to our office and haven't been in the area for a long time. It's really helpful too, so people feel comfortable coming with many diagnoses.
Right.
Some of the more common ones, I say probably low back pain is probably the most common.
Is it?
It's the most common injury. Now we can take it from the different population ages from a young adult.
Yes.
They might have hurt their low back doing an exercise,
Yes.
by doing a track workout or playing football,
Yeah.
where someone that's maybe a little bit older might have had postural changes, might be a work-related issue. Maybe
Yes.
they spent 8 hours at the computer.
Yeah.
And as we get even older, that say after you get retired, that it's more of a postural issue from
Yes.
leaning forward a little bit, from some different
Right.
things that our parents told us to really be careful of,
Be
to
careful.
sit up straight.
Sit up straight.
Right. So we can have a variety, and that can relate to, again, low back would probably be the most common, though.
Yeah. That's a common problem.
Low back is very common. They say over 90% of people at some time in their life will have some low back issue.
Now, how do you approach that particular problem?
Well, the first thing we have to do is being physical therapists, and I think this is the thing that I like the most, is it's kind of like we have to be detectives to figure out. And the biggest thing that we want to pay attention to is listen to what the patient is telling us.
Okay.
And if we don't listen to what they're telling us, then we might miss the most valuable information, because
Yeah.
patients know what's going on.
Yes.
So after taking the history, we decide, is it a trauma, was it a strain, was it a sprain? So we have to ask them a lot of questions to figure out how did they actually get it.
Yes.
So relating back to a student, it might be as simple as they pulled their hamstring,
Yeah.
they started running a little bit different, now they have low back pain. So if that was the issue, by just addressing their low back, we're missing that the hamstring was the initial injury. So we would want to address the low back and what caused the low back injury.
So you have to see how relate it to the injury itself.
Exactly.
And then work from there.
Right, and that would be called the mechanism of injury. How did it happen?
Yeah.
And the same thing could be related to another really common injury is neck pain.
Neck.
It would be really easy if a patient came in and said, oh, I was in a car accident. Well, then we know it's probably a whiplash type injury.
Right.
But sometimes they might come in and say, I've been developing headaches for 2 or
Yeah,
3
right,
months.
yeah.
And so one of the things that we can ask them is, okay, you've had it for 2 or 3 months. Well, what changed back 2 or 3 months ago? And they might say, I can't really think. Then we have to dig a little bit deeper.
Right.
Well, where do you work? Oh, yeah. I'm a computer specialist. I do data entry. Oh, okay. Well, what happened 2 or 3 months ago? The patient very often comes up with a reason. Oh, 2 or 3 months ago, we had a new supervisor that came in, changed all of our chairs, changed our desk sites, and they had all different things they wanted us to do. That's when it started. So it may be as simple as working with the patient to change the ergonomic setup at work.
Right.
A lot of times, it's a postural thing. It's telling someone not to sit up a little bit straighter.
Yes.
Look at the height of their monitor.
Yeah.
Look at their chair that they're sitting in.
Yeah.
But again, it's very important just to listen to the patient, because that's where we're going to get the most valuable information.
Now, this is a case then where the physical therapist would work with the neck, around the head and neck.
Correct. Right. Some of the things that we might do, again, we need to figure out, is it a muscle issue?
Yeah.
Is it a joint issue? Maybe
Yeah.
one of the joints in the neck are a little bit twisted,
Yeah.
so that might be an issue. We might have to do some joint mobilization.
Yeah.
But it could just be a muscle issue where, from having that forward head posture, the muscles have a lot of strain. So we might need to just correct their posture and then work on strengthening the muscles that help them hold up their head.
Well, basically, Todd, people come to you because they're hurting.
Correct.
Right?
Correct. Correct. And to go back to another issue that you said, initially we might not make many friends, because during the initial evaluation we have to kind of feel around, we have to assess some of the tissues.
Right.
That might not be that comfortable. So, but after we can assess the situation fully, then we can start to make them feel better. So by the end of the session, or by the end of their complete sessions for the course of physical therapy, very often they're very happy with the results.
Now, I know, because of recent experiences, that the therapists or the assistants keep very definite records of your progress as you're going through various kinds of rehabilitation or whatever that
Yeah.
they're dealing with, which gives So they really build a chart on a patient. First, there's something that your situation has to be diagnosed as to what the problem is, but then they follow the progression of the care to see where things are getting better and maybe where you need to do more work.
Exactly, that's correct. So how that starts, say we typically have a patient come in for the first time, we do what's called an intake with a receptionist. One of our wonderful receptionists will do an intake, and they get all the patient's history to see if their diagnosis is appropriate for our facility.
Right.
So then they come in for the first time, and they fill out some paperwork. And the reason why we have them fill out the paperwork is because we want to know as much as we can about them. Say they had a cardiac or a heart issue. Say they had high blood pressure. Those are things that might impact our treatment significantly. After they fill out the paperwork, then the physical therapist takes them in and does the evaluation, where it's a series of questions. We ask them to do a few movements, might be their arms, their legs, whatever they're coming in for. Then the physical therapist comes up with an assessment, and then we talk with the patient about what the plan is going to be.
Yes.
So that's all well documented. After we see the patient for the first time, the initial evaluation goes over to the referring physician, because again, we really want to keep that contact with the physician and the patient.
Right.
After that, for the follow-up visits, we also document for a number of reasons. The health insurance wants to make sure that all of our physical therapy is medically necessary.
Okay.
And what that means is it's provided by a skilled physical therapist or a skilled physical therapy assistant. Our job is not to watch someone do 20 straight leg raises.
No.
Our job is to get them out of a chair and functioning,
Right.
to go up and down stairs,
Yes.
to kneel, or maybe return to their work.
Yeah, right.
And so with that said, we have the physical therapist and physical therapy assistants document each and every time. Sometimes we try and keep each patient with the same physical therapist or assistant. Sometimes with the patient's schedule, that doesn't always work out. But either way, we have excellent physical therapists at both of our facilities, and they're able to follow through with each of the notes on a daily basis.
So they start with the notes.
Correct.
And work from there.
Correct.
And well, they're just great. Now, what kind of work would you do with children?
We don't see too well in our clinics. The two clinics that we have, they're primarily outpatient orthopedic clinics.
Right.
And what that means is people usually come in to see us for an appointment. So those are the patients we see. We don't see too many children that have any developmental delays, but we do know people that we can refer out to. So for children that would be 5 to 10 years old, it might be a twisted ankle, a sprained ankle, a broken bone. Those are very common things that we'll see in children.
Children, yeah. Now, what about sports? What about ski during the winter months? Ski problems?
Over the winter months, we see a lot of slip and falls.
Oh.
We see there's definitely some skiing, some sport-related incidents.
Right.
Snowmobiling, could be a lot of car accidents. Yes,
Yeah.
yep. Yeah, those are definitely common diagnoses that we see.